Marfan syndrome is a well-known risk factor in pregnancy for aortic complications like dissection of aorta. Ryan et al. Has reported the long-term follow-up data of around 70 women with Marfan syndrome undergoing nearly 200 pregnancies, of which 170 resulted in live births. 10% had obstetrical complications and adverse fetal outcome occurred in 13%. None of the women had aortic dissection or required cardiac surgery during pregnancy. But the long-term prevalence of aortic dissection and elective aortic surgery was higher in women who had a prior pregnancy. Greater aortic diameter, greater increase in aortic size during pregnancy, increased number of pregnancies, absence of beta blocker use during pregnancy, and absence of prospective pregnancy follow-up were risk factors for adverse cardiac outcome in this study. Low incidence of aortic complications during pregnancy for women with aortic diameter less than 4.5 centimeters and Marfan syndrome was commented by the authors.